Thank you, Dr. Robbins, for spending your time today to answer a handful of questions. There's plenty of people out there that are on the fence about receiving ozone therapy treatments, and we'd like to help make them feel more comfortable about giving it a shot. So I'm just going to spitball some common questions that I hear other people ask. So here we go. Question number one that I hear most often is, as a podiatrist, what qualifies you to treat infectious disease via ozone therapy?
Okay. First, I want to thank you very much for doing the interview podcast, however this is going to show up. I've been doing quite a few of them lately because of everything that's been going on, and it's my pleasure to do them. Secondly, to answer your question is very important. I began doing intravenous ozone therapy a little over 29 years ago. This is our 30th year that we've been doing it, and we've done over 350,000 treatments now in these past 29 plus years. It was my buddy, Dr. Robert Atkins, the diet doctor, who got me started way back by telling me I have to start doing this, and was November of '89, and by January of 1990, that's when we began doing all these therapies, and we've done so much since then, proving not only its effectiveness, but its safety. Now, for those that don't understand, a podiatrist, by the way, is a licensed doctor in the state of New York. We're allowed to treat all the medical conditions and diseases that might affect the foot and leg, which is just about everything that affects the human body. Everybody that comes in to visit me may have a different agenda on their mind. Perhaps they want to get rid of COVID-19 or some other medical problem, but which may not directly affect the foot. Interestingly enough, COVID-19 virus does cause a rash in some patients that goes all the way down to the foot, which does make it in my repertoire of conditions and diseases that we can fix. Rheumatoid arthritis, Lyme disease, osteoarthritis, multiple sclerosis, herpes, all these are common infections and diseases and conditions, and many, 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 many more that does affect the foot and leg, and we have a legal right in New York State at least, as well as the rest of the 49 states in this country. It's to fix and treat all these diseases and conditions. So when a person signs a consent form in my office, it shows what my agenda is, even though they may have some underlying agenda that they communicate that's more important to them. Also, very important to know that we have to practice legally and within the law of saying that I'm only allowed to treat certain things, and prevention, however, is a very big part of our practice. So preventing problems that might affect the foot and ankle is part of what I do. And a big part, which means many diseases and conditions that you might be concerned about through the rest of your body can get treated under the auspices of prevention. Another thing to understand is that most of the doctors that practice what we now call functional medicine. When I began, it was back in 1977, making the transition. It was called natural medicine, then it was called holistic medicine, then it was called complementary medicine, then alternative medicine, and now it's called functional medicine. But any of the doctors that practice all these variations of the same thing, there is no specialty for it. You don't go to school to become a functional medicine doctor. Bob Atkins was a cardiologist. Many of the doctors that practice functional medicine were family practitioners, psychiatrists, all sorts of various specialties having nothing to do with what we do now, natural approaches, safe and healthy approaches to treating the body.
Perfect. Okay, so the next question is, I hear a lot of concerns about ozone therapy and ozone gas and embolisms and whatnot, air embolisms. Can you speak to us about that?
Well,
like, is there a threshold where someone can get too much ozone and die?
The answer is yes. If a person has medical ozone used improperly, they think it's so easy because they see a YouTube demonstration of it that they could do it themselves at home. It can be just as dangerous as doing an abortion at home yourself, rather than going to a licensed, trained medical professional who's taught how to do these things safely and effectively. There's many different aspects to it that will make it safe or make it unsafe. Embolism, however, is not one of the issues, ever. Virtually speaking, and what most people don't realize is that it would take gigantic amounts of air to possibly even cause what we call an air embolism. Ozone therapy doesn't use that much medical grade oxygen and ozone, medical grade ozone, O2 and O3, that would even come close to using the amount to creating an embolus in the body. The blood is hungry for the oxygen and ozone gas, which dissolves instantly in the blood, creating what we call ozonoids that actually go around the body and do the work. Though some ozone may actually attach to the ion molecules that are devoid of oxygen in the venous blood, that are empty of oxygen, and carry it around the body, it's already attached to the red blood cells, so it's not a big bolus of anything. So where did that notion come up? That's a very good point to bring up, because you're right, a lot of people have that concern, and it's an interesting history. It came up from television shows and movies of the 1950s and 60s, when it was all black and white. We didn't have color. So when a mafioso informant was shot but not killed, and he's laying in the ICU unconscious, the mafioso hitman would come in, sneak in, and shoot an empty syringe. Looks like this. And push that in, and it would go beep, 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 and the cardiac monitor then would go beep, and he'd be dead. Today, we know that in almost every IV performed in a hospital, the air gets in frequently, so it doesn't cause embolisms. At the same time, it happens in neurosurgery in quite a bit of the cases, and they know how to give you some extra oxygen by mask, and that gets rid of that. So what they now do in movies, if those of you are movie buffs like me, is they use a syringe, a phony syringe of course, and it has neon green, yellow, or blue, supposedly poison in it. And when they push that in and it disappears, because it's a phony syringe, it's made to do that, like a magician does, the milk container trick. Well, when that goes in, the same beep, 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 beep occurs, and that's it. So why did they go from nothing to colors, color television, and color movies? And that's why you see that today. Virtually impossible to cause an air embolism, keeping in mind that air is 70% nitrogen, and the concept of embolisms come from scuba diving, or coming up too fast, not from intravenous medicine. So here's a good question for everybody. Why do doctors tap out, when you fill a syringe, why do they tap out the air bubbles if those little bubbles can cause an embolism? And I have to tell you that 97 out of 100 doctors that I train don't know the answer. They come up with, okay, why? Or they come up with answers that are absolutely wrong. And the answer is to get an accurate amount of medicine in the syringe, because those little air bubbles are taking up space. Now, where did I learn that? From a blind diabetic many years ago who had to get an accurate amount of insulin in his syringe. So getting all those little air bubbles out for him were important, and he developed and showed me the techniques that he was taught to make that happen. And that's why doctors need to tap those air bubbles out, only for that purpose whatsoever, not because it can harm anybody. What's your next question?
You know, you answer so many questions when you speak. You're literally taking away half my questions, which is great. I don't have to ask a lot of them. You already go into them. Now, so you as a world leader in ozone therapy, can you say that ozone therapy in any capacity, any form, whether it be 10 pass or direct IV or whatever the case is, Has ozone killed anyone ever in the world?
Unfortunately, the answer to that question is yes, even when performed by a doctor. One of the blood methods called major autohemotherapy, where you take out about anywhere from 50, but usually 200 to 300 cc's of blood, 200, 300 mLs of blood, and then you ozonate it by pushing the gas into the bottle and you mix it through. That has caused not many, but about 4 deaths that we know of 4 to actually maybe even 5 now worldwide. When you consider the millions of treatments done, 4 or 5 deaths don't seem like very much at all. But that can cause a blood clot, which can cause an embolus, which may lead to death. Now, we believe in the ozone world. And by the way, between 1990 and 1995, our clinic did over 45,000 plus of these treatments. And of course, we had no deaths. You know, I practice here in Midtown Manhattan in New York State. New York State doesn't care if I kill people with pharmaceuticals, which are notorious for doing that. Bottom of it all is, when done correctly, even MAH can be performed safely. So it's hard to understand why the doctors hurt anybody with it. We believe it was underlying conditions that weren't discovered that caused it to happen, not actually the MAH. But there have been recorded deaths done by medically trained professionals using that method. From the methods that we use here, the Robbins method version of the direct intravenous ozone therapy, this is where we push the oxygen and ozone gas directly in the veins. We've done over 305,000 of those, and we've had virtually no negative reactions at all. In fact, we've only had 2 allergic sensitivity reactions in all these many years of doing it and hundreds of thousands of treatments, and 7 temporary rashes that may have been a purging, even though we always err on the side of safety. We take Dr. Do No Harm very seriously here, and I may have stopped those people from doing it unfairly, but I don't take chances with anybody. You know, I have to go to sleep at night, among other things, and I'm not the kind of doctor that can hurt somebody and go to sleep at night and not care. Keep in mind, surgical procedures kill people every day. There's several 100,000 people die in hospitals every year from improper treatments and reactions to medications that they shouldn't have been given. People die during surgeries all the time because of reactions to anesthesia. These are things that people have to understand. When you're practicing medicine, death can occur from things that are routinely done, and we don't stop practicing medicine because these things happen. But having said that, virtually and very few deaths from ozone therapy. The 10-pass method, where blood goes in and out very rapidly, there's only been a few 100,000 of these performed at this point in time, possibly worldwide. So there's no real abundance of treatments. I don't even think it's been 300,000, but possibly. And nobody has ever died from that method, only from the MAH method that they like to use predominantly in Europe and to some degree here in the United States.
Okay, great. And speaking about side effects and rashes that people have experienced, 2 things that you hear quite a bit about are, 1, tightening in the chest, and secondly, I don't know if I'm pronouncing this right, the Hertz reaction or whatever it is?
Herxheimer reaction.
Herxheimer reaction. Could you explain those 2, please?
Sure. Well, initially, when 85, because we've done a safety study, when 85% of the patients get the direct IV method, once again, that's where we push the gas directly into your veins. Not only will the ozone destroy every virus, fungus, yeast, mold, bacteria, parasite, toxin, and harmful free radical in the body, but ozone is also going to react with harmful free radical gases. The human body contains up to 3% of these gases in the blood, such as carbon monoxide. Now, that's something everybody here knows what carbon monoxide is. It comes out of the exhaust from cars and trucks and whatnot. So when ozone meets carbon monoxide, it transforms it into carbon dioxide. And everybody pretty much knows you can breathe carbon dioxide out. We inhale air, we take the oxygen out of the air, we put it into our blood because we need oxygen, and then we exhale the waste product, carbon dioxide. Well, you can't exhale carbon monoxide. So when ozone, O3, combines with CO, carbon monoxide, you get oxygen, O2, which stays in your blood, and we need that, we know that, and you get carbon dioxide now. CO becomes CO2. As in the first few treatments, as that builds up around the lungs in larger amounts than normally we have inhaling and exhaling, it puts a pressure on the chest. And that's why we give moderate doses to begin with and increase the doses as that reaction diminishes with each treatment. So we're actually giving more medicine, more ozone, and getting less of a reaction with each and every treatment. The only other reason for that tightness in the chest feeling has to do with the fact that you may have a lung infection or a lung disease, like COVID-19, for example, in which case the ozone is going to be destroying that infection and causing that tight feeling or irritation. Well, we already know what to do for it no matter what the cause is. We just give you by nasal cannula, you've seen it in the movies, you may have even had it, oxygen by nose, attached to another tank. You inhale the oxygen through the cannula in your nose and you breathe out your mouth, and that blows away that reaction. So even people with lung diseases can effectively get the treatment, no matter what they're being treated for, in any doctor who does ozone therapy who's well trained. And that would get rid of that problem from happening. Most of the blood methods don't cause that problem, though occasionally they can, along with a very special form of ozone sauna called Hocket. That's spelled Hocatt. And you go to Hocket USA, and you can learn all about how that special ozone sauna that does 5 or 6 other therapies all at the same time can be used, and now you don't need any needles at all to get some benefits. It's not the same as doing IV ozone, but it's certainly tremendously beneficial, and particularly people who are needle phobic, it could be the only way to help them. Patients with very bad veins could be the only way to give them some medical help and benefit. So that's another method that we use. Now, Herxheimer reactions. Dr. Herxheimer from Germany and Dr. Jarisch, nobody ever mentions him apparently but me, came from Switzerland, and they described a reaction that they noticed in patients many years ago when they did their work from the use of antibiotics. So antibiotics cause the kill-off, I'm going to simplify it for everybody, cause the kill-off reaction in the body of all these bad bacterias, and good as well. And with this kill-off reaction, if your body wasn't well prepared, for it, you would have a reaction take place. The reaction basically would be described in a mild to moderate Herxheimer reaction, which is commonly called I'm herxing or I've had a herx. That's where they get those nicknames. Of course, it's not easy to say I had a jarish or I'm jarishing. So they used herxing because it sounds better, I guess. So when they have a mild to moderate one, you'd feel tired or sleepy after taking the antibiotic. And when a person is fatigued, is ill from something, they take their first doses, they get that way, they fall asleep. In a more severe Herx reaction, you want to sleep, you have to sleep, And in a very severe Herx reaction, you get a little bit of a fever and chills because your body is fighting this infection and you can't get rid of the waste fast enough. Almost flu-like symptoms with a little muscle achy and joint achy. And then it goes away and you get a return of energy and everything else within usually 24 hours. It's not a bad reaction. It's not a negative reaction. But it's an overreaction to your body not being prepared by drinking enough water, being well hydrated, and taking vitamin C, believe it or not, as much as you can, your stomach can tolerate 5 or 6 times a day. By taking the water and the vitamin C in our practice, we pretty much avoid 99% of the Herxheimer reaction that patients could have. So prevention being everything, we learned how to do this. Keeping in mind that water is very important because 60 to 70% of our body is water depending on the organ, and you can't have a functional immune system unless you're well hydrated. You can't eliminate the waste unless you're well hydrated. Vitamin C is very important for many, many reasons. It helps in blood flow and vein repair. It's very important to help keep all your body processes working correctly. It's not just a vitamin, it's also a coenzyme. And it stimulates every natural cellular reaction, healthy cellular reaction to take place. So bottom of it all is by taking vitamin C and drinking water, we prevent herxing in virtually almost all the patients.
Awesome. Thank you for that. Now, is there a reason why that you could see that ozone has not made it to the mainstream without discussing big pharma or politics?
Without discussing big pharma or politics?
Yes.
No. I can't see a way of discussing it without discussing big pharma and politics.
Okay.
But I'm going to start off with something very simple. It's not a patentable medicine. We make it in the machine sitting next to me in a medical ozone generator at the moment that we need it because it's not a storable medicine. Ozone breaks down very rapidly. It's a highly reactive molecule, which is why it works. So you make it at the moment in time that you need it, and then it's gone. If it were a patentable medicine, if we could put it into a capsule pad or a tablet in an effective way, then Big Pharma would love it and it would be in every hospital in the world. But because it's not a patentable medicine, studies have lacked in it because, studies are done generally paid for by Big Pharma, and they cost millions of dollars to get a medicine on the market anywhere in the world. And since they're not interested in doing that, the use of ozone languishes in many hospitals, in hospitals and around the world, because Big Pharma hasn't paid for those research studies. All the studies and all the research done are done by private doctors like myself or in small clinics around the world, and we get it published as best we can. And that's that. Government only does what Big Pharma and insurance companies tell them to do and what seems to be in their best interest. To get out of the box thinking in the box is a very hard thing for them to do because politicians are just people. And they only know what they were brought up to know and what they were brought up to use and do. And since that's what most doctors do, that's what they believe will work, and that's what they put their faith and trust in. Put aside how many pharmaceuticals are taken off the market each year because they harm people, even after they've gone through FDA approval in similar organizations in other countries. And if you listen to the television commercials and read the magazine commercials that go on, they tell you in all the warnings of the new medications that are out there. It's kind of hard not to be fair and give both sides to the story when you ask, can I leave those things out? I don't know that I can.
Well, and that's a perfect segue to my last question. Okay. Perfect segue. This has been going along perfectly right here, so thank you. The last question is this. Unfortunately, there's a lot of folks out there that do not understand or see the value in anecdotal experiences that people have as if they don't exist somehow. And a lot of studies that you'd find on PubMed.gov, more often than not, that's what you'd find in comparison to what you would find on clinicaltrials.gov. And there's a difference between how both sites are treated when it comes to refuted information. Like for PubMed.gov, you have watchdogs that always update refuted information, as opposed to clinicaltrials.gov, you don't have anything like that. Instead, it's up to the sponsoring corporation or entity or body that's in charge of, okay, if they find something, it's up to them to change it, and okay, if they have to be ethical in order to do that. And as you know, people aren't always ethical. So is there anything that could be of value that's worth mentioning to someone where anecdotal evidence really doesn't mean much, but perhaps they're going on clinicaltrials.gov looking for clinical studies that have been performed, looking for the effects of ozone on pathogens specifically?
Okay. Well, first of all, doctors like myself are faced with a very difficult situation. How do we do a double-blind study? When you're trying to do a double-blind study, you're faced with this. There are a group of people that are going to get the medicine and a group of people that are not. The people that are not going to get the medicine may not get well when you know you have a medicine that should get them well. So this is why clinical trials are usually left to institutions, medical schools to do, and hospitals to do these kind of clinical trials. This is also another problem as we're faced with, is that it's expensive to do them because generally the participants have to be paid, and that's where Big Pharma spends millions of dollars in paying them to do these trials, or the doctors that are doing the research have to be paid by Big Pharma. They don't do it for cheap. They don't do it for free. They're funded by research grants, where private doctors like myself are not. In addition, and I guess this is also very important to understand, besides the human factor, why would you not want to treat somebody who's sick and or dying and you know you have something that may help get them well with a placebo that may not work, knowing that their life is at stake? It becomes a moral and ethical issue for us. So that's why you're going to see a lot of research studies and published that we've done, doctors have done, show with case studies in there showing the benefits to individuals, if you want to call it anecdotally, versus double-blind clinical controlled studies. There are some in ozone, they have been done, and I'm going to tell you about an important one in a minute. But they have been done, and when you go to our National Library of Medicine, which you alluded to, is pubmed.gov, pubmed.gov, and you type in intravenous ozone therapy in search, you're going to get about anywhere from 80 to 100 and some odd recently published studies showing ozone's medical benefits, with an occasional one talking negatively about it. When you see there's 80, 90 positives to one negative, it makes it pretty clear how powerful this medicine is, and yet it does have to be done correctly by doctors who are medically trained, not who think they know what they're doing without getting that certificates and training. I train doctors from around the world, and by the time they're done training with me or my buddy Dr. Robert Rowan out in Santa Rosa, California, we know that they know what they're doing and that they're going to do it correctly. Now, having said that, there is an organization called the Global Lyme Alliance. Those of you with Lyme disease may know who that is. It's a not-for-profit organization, been around quite a few years, and they raise millions of dollars each year for research to find a more effective treatment for Lyme disease and a more effective test for it. Well, after quite a few years of being pressured by many people who have been treated by it, they put out a $1.25 million grant, which was awarded to Tufts University Medical School and Boston's research department. And it is now being researched in how ozone therapy will get rid of Lyme disease. First, it'll be test tubes and then mice. And then eventually, what I've been doing, in a sense, for 29 years, human trials. And now this will be done with a double-blind, placebo-controlled study to prove that ozone therapy is an effective treatment for Lyme disease, which we've known for years now. And with that, and getting published in medical journals, it could open the door then from all the hundreds of doctors around the country that treat Lyme disease day in and day out, year in and year out, as a standard of care treatment for it. And then ultimately, doctors will experiment, as doctors tend to do, and go and try it on various other diseases and conditions that it should work on. And then they will also publish on that. Hopefully that will lead to other controlled studies done on it, clinical trials. And remember, clinical trials require, and something I mentioned before I was alluding to but didn't mention, what they call an independent review board. The IRBs, as they're called, independent review boards, oversee clinical trials. They're expensive to pay for in most cases, and therefore most private clinicians like myself can't afford to pay for an IRB to oversee an in-office clinical trial. And that's something Big Pharma does pay for as well. Hospitals and medical schools pay for. They usually have their own IRBs set up. And they oversee the safety of this, whether it be for animals, which I'm told is much tougher, IRBs overseeing animals, knowing that the animals are going to be euthanized when they're done. They're very serious about protecting the animals so that animals aren't abused and needlessly harmed during these clinical trials, and much less caring about people apparently in the IRBs that are set up for everybody else, for us, human men and women and children. And that's another reason why ozone clinical trials have languished, because you need IRBs for them as well.
So although a particular individual might not have their curiosity satisfied with clinical trials and mainstream medicine, as far as those two are concerned, the industry is well on its way to bringing it there.
Well, we have been working on it now for 30 years, and Dr. Rowan, 34 years out in California. Together, he and I have been doing everything we can to help bring this to be mainstream medicine. There's other supposed leaders in the ozone world who are just looking, in my opinion, to help train doctors. They have the right attitude. They're looking to help train doctors, get them to use their other methods of ozone therapy, which I'm totally in favor of. Any method of ozone therapy is better than no ozone therapy. But they're not out there actively, the way I see it, trying to make this mainstream medicine by publishing. Last year, Dr. Rowan published a general article on ozone therapy here in the U.S. We jointly published 2 papers showing ozone's effectiveness against complex regional pain syndrome, a very horrible situation that occurs to 2.5 million Americans every year. And ozone therapy has been proven through my method to work against it. I got the Reflex Sympathetic Dystrophy Association to start working with me till this virus issue hit. We were going to get some people in for special treatments at no cost through them to prove that this is an effective treatment for it, which no one in the world has been able to help but myself. Dr. Rowan and I published on that. I was published last year on mold toxicity and mixed mycotoxicosis. This year, Dr. Rowan and I were published on March 6th in the Journal of Infectious Diseases and Epidemiology on how ozone therapy will be effective against the coronavirus that we're now in the middle of a pandemic with, which is now being used in one form or another in 17 hospitals in Italy, and many hospitals now in Spain effectively to treat coronavirus. A little too late for all the thousands of people that died there, but not too late for the others. And yet the media here isn't picking up on it. It's a shame. They should be publishing and talking about how it's being used there so we can bring it into some clinical trials here.
Here's a question. When you have the hospital helping so many people like you have out in Spain, is something like that considered something that could be seen as a clinical study in a way, or is that information too anecdotal?
No, it's not anecdotal anymore at all, because now that they're permitting it as a form of clinical trial, they're getting great results, and it's all going to be documented. And with that, they'll be able to publish on its beneficial effects against this. When that starts getting published, there's going to be a lot of rotten egg on the face of the news media here that's rejected this information. Remember, we published on March 6th in the Journal of Infectious Diseases and Epidemiology, and the news media virtually has ignored this or rejected it. Not wanting to print the stories or even investigate the stories to see if it's true, which would be criminal if we say it does work and it's not. And yet we're proving around the world that it is working already. And of course, politicians are more interested in telling you to stay at home and just trust that doctors will come up with some answer than to listen to us and say, hey, we may have an answer for it now, and you should be looking into ozone therapy to treat it.
And the reason that it can be considered a clinical trial is because it's being performed in a hospital and paid for by the hospital.
Well, it's being performed in a hospital, whether it's paid for or not. We'd be happy to train doctors in hospitals to do it, oversee the treatments, and not charge anybody for any of it. This is, we're in the midst of a very serious pandemic, and this is not where money should come into the mix at all, and where we're willing to work for free in hospitals to do just such a thing. The fact that the Robbins method of direct intravenous ozone therapy cost pennies, literally less than $1 a treatment, makes it extremely available for almost anybody who wants to get the therapy and wants to prevent getting the infection as well. Fact is, if people just stayed well hydrated, if they drank vitamin C 5 or 6 times a day, and if they went online and purchased a probiotic drink called Doctor's Biome, and I think I should tell everybody that's spelled DOCTORSBIOME, doctorsbiome.com. They would be able to buy that product and boost their T cell system by getting yeast in their gut back in balance, something that virtually probiotics are destroyed in the stomach and don't really reach the gut and the gut wall where you need them. And Doctor's Biome being specially made, as you can read about it online, I don't want to spend the time talking about it now, to boost that T cell system by helping to get yeast in the wall of the gut back in check again. Since they survived the stomach over 85%, this could make a very big difference to people not getting the virus or minimizing the effects of this or any other virus for that matter. So that's something very important that everybody can do. Water, vitamin C, and Doctor's Biome, and if they just wash their hands, keep their hands away from their face, those are the standalones that almost everyone can do in this pandemic if they can't get intravenous ozone therapy to protect themselves and their family and friends.
Awesome. I have one more, but I don't want to take up too much more of your time.
I'll give you one more.
Okay. No, this is... I'm just hearing this from somebody else. These questions aren't necessarily come from me. It's just stuff that I'm hearing. If Big Pharma is really looking to make the most money it can, okay, which of course is any business. Now, do you feel that the Big Pharma has more potential to make more money from ozone and patented oxygen tanks versus the drugs themselves?
Big Pharma can only make money from patented pharmaceuticals, capsules, powders, tablets. That's how they make their living. And never fault anybody from trying to, make a living and send their kids to college. Unfortunately, many times they already know from their clinical trials that they adjust when they submit their information to the FDA that there may be some risks involved, and that's why certainly during the first year that those medications are on the market, deaths occur to the point where they pull them off the market. That's not to say that pharmaceuticals aren't important and necessary in our society, because sometimes diseases and conditions that are life-threatening will take your life faster than natural medicine like ozone therapy can prevent. And there's where ozone therapy, the way we do it, works synergistically with pharmaceuticals, so you can do it. There is no way for them to patent this medicine in any manner, shape, or version. They can't put it in a tank. Thus, they can't sell it. And if they can't sell it, they can't make any money. So no, I don't see Big Pharma working with Ozone ever.
All right, that's it. And where could people find you?
Well, you can go to my website, ozonedoctor.net, OZONEDOCTOR.net. And that's the best way to get my numbers and reach me.
Excellent.